Good day, panelists, and to our research proctor, Mr. Paul Abisilia. We are the thesis group number 208 research entitled Correlation of Psychological Distress to Academic Procrastination of College of Arts and Sciences students of Pamantasan ng Lungsod ng San Pablo. To start our presentation, we would like to thank you, our panelists, for your time and support to make this research defense happen, and to our hardworking instructor, Mr. Abisilia, thank you very much. For our introduction, academic procrastination is a common experience issue among university students, which generally affects their academic performances negatively. Previous studies indicate that more than 70% of the university students committed academic procrastination, and one of the most prominent factors is learned helplessness, the perception that one is incapable of finishing tasks well. The researchers aim to determine the correlation between psychological distress and the academic procrastination. Psychological distress is a serious matter that should focus on such as depression, stress, and anxiety. Our theoretical framework focuses on academic procrastination. Views about academic procrastination in students' population evolved from behavioral theories. A behavioral interpretation views academic procrastination as a task-specific avoidance behavior. Reinforcement theories views learning as the reassortment of responses in a complex situation. In this view, academic procrastination depends on both punishments and rewards. Procrastination occurs most frequently in students who have either been rewarded for it or who had not been punished enough for the behavior. Students who procrastinate have a history of successful procrastination, or at least finding more reinforcing tasks to do than studying. Academic procrastination is a behavior that is common among college students. According to Solomon and Rothblum, found that 36% of undergraduate participating in their study procrastinated in writing term papers, 27.6% when studying for exams, and 30.1% when reading weekly assignments. For our conceptual framework, the researchers assess whether psychological distress affected academic procrastination among the respondents. The academic procrastination is the dependent variable. Depression, anxiety, and stress are psychological distress regarded in this study as independent variables. These are the variables that the researchers would like to correlate with academic procrastination. Our significance of the study tackles on the academic procrastination is detrimental to students' academic performances. Thus, the result of this study are significant to the following. Firstly, for our guidance counselor, the result of this study will serve as a basis in crafting homeroom guidance program that addresses academic procrastination problems. Secondly, for the student organizations, the result will guide officers including mental health program in priority projects. And lastly, for the future researchers, this study and the student will serve as a basis in conducting future researches. For the statement of the problem, the study aimed to correlate psychological distress to academic procrastination of students from the College of Arts and Sciences of the Pamantasan ng San Pablo. Firstly, the researchers would like what is the demographic profile of the students, their sex, and their course. Secondly, what are the levels of psychological distress among students? Next, what are the levels of academic procrastination? And lastly, is there a significant correlation between psychological distress to academic procrastination? The study was conducted to determine and identify the correlation between psychological distress and academic procrastination of the selected College of Arts and Sciences students of the Pamantasan ng Lungsod ng San Pablo first semester academic year 2021-2022. The researchers' use of a procrastination assessment scale for students and DAS-21 as assessment tools to measure the level of procrastination and the level of depression, anxiety, and stress respectively. The assessment tools were sent via Google Form. Specifically, the researchers focused in identifying levels of procrastination in writing a term paper, studying for exams, keeping up with weekly reading assignments, academic administrative tasks, filling out forms, registering for classes, and getting an ID card. And lastly, attend a stance meeting with advisor, making an appointment with a professor, and school activities in general. The researchers limited the number of respondents due to the pandemic that made communication, distribution, and retrieval of assessment tools difficult.
Research design. The researcher utilized descriptive correlational research design. Descriptive correlational research design is a scientific method which involves observing and describing the behavior of a subject without influencing it in any way. It describes the variables and the relationship that occur naturally between and among them. So the study's objective is to determine the correlation of psychological distress to academic procrastination to the Department of College of Arts and Sciences, students of the Pamantasan ng Luzon ng San Pablo. The participants of the study were chosen via clustered sampling. A clustered sampling is a sampling method used when assorted groupings are naturally exhibited in a population making random sampling from those groups possible. The use of the technique requires the division of classification of the population into groups, defined by their assorted characteristics or qualities. These groups are called clusters.
Research instruments. We use two different types of scale in our research. First is Procrastination Assessment Scale of Students, or PAS, of Max Krusky and Shershaw, to measure the academic procrastination of students based on the analysis of 6 areas of academic functioning. This scale assesses the degree to which student procrastinates in those areas and the degree which procrastination is a problem. The scale is scored on a 5-point Likert scale on the degree to which the procrastination is a problem. 1 indicates not at all a problem, and the 5th anchor always indicate a problem, while the 3 middle anchor are similar. To determine the minimum and maximum length of this scale, the range is calculated by 5 minus 1 equals 4 divided by 5, as it is the greatest value of the scale equals 0.80. Afterwards, 1, which is the least value of scale, was added to identify the maximum of the cell. The length of the cell is determined in our research. And lastly, we use Depression, Anxiety, Stress Scale, or DAS-21 items. It is a set of a 3 self-report scale to measure the emotional state of depression, anxiety, and stress. The 3 self-report scale assessment are indicated in our research. The scores of depression, anxiety, and stress are calculated by summing the scores for the relevant items. It is confirmed by the research data that the DAS-21 is based on the mentioned conception of psychological disorder.
For the research procedure, before we proceed to data gathering, we ask for the consent to the Dean of College of Arts and Sciences to formally conduct the study. But because of the current situation brought by COVID-19 pandemic, the only chance we had is to post the survey questionnaire through social media platform, which is Facebook. The assessment tool were disseminated and retrieved via Google Forms. This study utilized 2 data gathering methods. The first one is PAS, or Procrastination Assessment Scale for students. It is divided into 6 categories that contain 12 items. The next one is DAS-21, or Depression, Anxiety, and Stress Scale. It is the only one part with 21 items. Afterward, the data gathered were tallied and interpreted with the help of the statistician. For statistical treatment, the number of occurrence with particular gender and program and the summarized result of PAS and DAS-21 were both presented via frequency distribution table, so that it will be organized and easy to understand by the readers. While the level of significant relationship between the stress, anxiety, and depression and the level of passive academic procrastination was utilized through Pearson correlation coefficient.
Chapter 3 summarizes the study's findings and examines their consequences. In this chapter, we will also discuss the Table 1 up to Table 4 containing the results of our survey. Table 1 is the demographic profile of the study's respondents with demographic factor, gender, and subgroups male and female, and demographic factor programs with subgroup BS Psychology, AB Political Science, BS Public Administration, BS Economics, BA Communication, and not specified. Men made up 20% or 56 of the respondents, while women are made up 80% or 222 of the respondents. 188 or 71.22% of the 278 respondents had a Bachelor of Science in Psychology. 13 or 4.68% had a Bachelor of Arts in Political Science. 43 or 15.47 had a Bachelor of Science in Public Administration. 6 or 2.16% had a Bachelor of Science in Economics. 17 or 6.12% had a Bachelor of Science in Communication Arts, and 1 or 0.36% had no degree.
This table shows the number of respondents who registered moderate procrastination. A student who rated greater than 4 on each subscale has an average procrastination. The results from each subscale are shown in this table. The first subscale had 23 students procrastinating when writing a term paper. In second subscale, 28 students when studying for an exam. In third subscale, 30 students when keeping up with weekly reading assignment. In fourth subscale, 24 students when doing academic tasks. In fifth subscale, 18 students when completing attendance tasks. And the last subscale have 28 students when doing school activities in general. The result that most students delayed complying in reading assignment. According to Howaits, finding 55% of the surveyed students failed to read because of the conflict with their work schedule. The cycle of avoidance in this doing task is because of most of students view this as difficult, vexatious, and unrewarding tasks. So they tend to procrastinate, which make it harder for them and cycle continues. According to Thompson and Thompson 2015, on studying for exams, students frequently procrastinate because they do not see it as relevant or important to them, do not understand the material, or simply do not know where to begin. And also, according to Oxford Learning 2017, college student reading load is likely significantly higher than what they experienced in high school. And lastly, according to Lucier 2019, their hectic schedule usually does not leave enough time for extensive reading. The next table is table number 3. The frequency distribution of depression, anxiety, and stress scale 21 or DAS 21. In this table 3 summarizes the difference of levels stress, anxiety, and depression among the respondents. Based on the DAS 21 tool, in stress, we have 64 students have normal stress, 42 mild stress, 56 have moderate stress, 86 have severe stress, and 30 have extreme stress. In anxiety, we have 21 student normal, 11 mild, 36 moderate, 38 have severe, and 172 have extremely severe levels of anxiety. Meanwhile, in distress, we have 38 students have normal depression, 30 mild, 73 moderate, 59 severe, and 78 extremely severe. According to CUR 2020, there are a lot of quizzes, exams, and other workloads that why stressors arise due to overwhelming pressures and demands, especially to college students. And according to IM 2020, college is so new and distinct from any others life experience before it. And student minds are overwhelmed. That's why it typically produces overwhelming anxiety. And lastly, according to Brennan 2021, depression is a serious and important matter on college campuses across the globe because of the fast transition they have to face. Depression is usually accompanied with feelings of sadness and anxiety. There is no single source of this. However, there are several common factors that are noted among college students.
Pearson correlation coefficient was computed to assess the relationship between psychological distress and academic procrastination. It was found that stress has a weak positive correlation to academic procrastination. With this course, this implies that as the students procrastinate more with their academics, the more they will feel stressed. And in addition, it substantiates the study that academic procrastination has a negative impact on students' academic progress, causing stress and other mental health problems. Furthermore, anxiety has also a weak positive correlation to academic procrastination.
With this score, this suggests that students' anxiety tends to increase when they delay the completion of their academic tasks. Lastly, depression was found to have a moderate positive correlation to academic procrastination. Therefore, academic procrastination correlates with these subcategories of psychological distress, substantiate that academic procrastination is associated higher levels of psychological suffering. Moreover, it also supports that academic procrastination is linked to a variety of negative outcomes, including poor academic achievement, emotional well-being, mental health, and physical health. As a result, academic procrastination is frequently harmful to those who indulge in it.
This chapter summarizes the study's findings. It also contains the study's conclusions, which are based on the findings and aligned with the research objectives. This part also included research reviews and recommendations. In summary, 222 of the respondents were females, and 56 were males. The analysis of the findings revealed that all class students suffer from psychological distress but differ in levels. The results from the past shows that students who scored greater than 4 on each subscale have an above-average procrastination. Some students tend to procrastinate and have problems doing tasks in the field of writing a term paper, studying for an examination, doing their assignments, giving their time to do their academic administrative tasks, giving time to have a chat with their teachers, and lastly, doing school tasks in general. The researchers conclude that because students suffer from psychological distress, the students tend to procrastinate and have problems completing tasks in the area of keeping up with weekly reading assignments. The results from the past shows that students who scored greater than 4 on each subscale have above average procrastination. The results shows that most of the students from the College of Arts and Sciences of the Pamantasan and Luzon and San Pablo exhibited academic procrastination, since the result shows that of all the 278 respondents got greater than 4 in each subscale. In addition, it can be gleaned from the results that most of the students suffer severe stress and extremely severe depression and anxiety. The researchers recommended that the students must find ways for them to be keep motivated. The institution should focus more implementing psychosocial support programs for the students to avoid them to psychological distress and procrastination. With the right help, the right information, and the right support, academic procrastination and psychological distresses of the students can be controlled and they can maintain a productive and rewarding life. Utilize the results of the research for guidance and counseling programs that will address the psychological distress the students are undergoing.